Opening it now. You get to enjoy all the really lovely hits from Motown every Monday on Smooth 98.1. Love music, love life. That, of course, is Strictly Soul. That goes every day. That's weekday, every weekday from 11 to 1. And yes, right now you're tuning to Breakfast in Bed here on Smooth 98.1. My name is Oluwaseun and I do have my guest in the studio already, despite the heavy, heavy rain. I'm quite grateful. And if it is not raining at your end and you're wondering what I am talking about, maybe it will get to you soon. Just a little bit of patience. I do like the fact that the rain just comes in phases. I was talking with somebody yesterday and she said, "Oh, it did not rain here, not even a single drop. It was just cool breeze." But yes, you can be a part of our conversation right now. First, start on YouTube because we're streaming live. So what you have to do is go to youtube.com/slash smooth 981 FM Lagos. And then you click on the subscribe button and, of course, the notification bell. Now you can watch us and see what's going on. Also, you can drop your comment and whatever it is that you have to say in the chat box option. And then you can come to WhatsApp too. That the number is 0809 or you can call on 01 448 9981. Ladies and gentlemen, we know her as the dancing doctor. She's very beautiful and this morning she's looking extra radiant, I told her.
Oh, thank you. Good
Her
morning.
name is Dr. Folakemi Cole-Adeife. She's a consultant physician and dermatologist. Good morning.
Good morning.
How are you doing this lovely wet
I'm
morning?
doing great. The rain is always a blessing. So,
Right, especially when it concerns cooling down the
oh
dust.
yes,
I'm all for
and the
that.
heat.
Yeah.
Yeah.
Okay, so this morning we're having something different. The last time you were here, we were talking about skin lightening, and I
Yes.
think that was in September. But this
Hmm.
morning we want to talk about acne, something that has plagued a number of people,
Yes.
bashed self esteem, and people do not know
Hmm.
how to go about it. But
Right.
first, I want to just create that clear distinction to be sure to just help people establish, is acne the same as pimples? That's the first place we're starting.
Okay. Yes. So I think pimples is the colloquial term for acne. Acne is a medical diagnosis. There are different types of acne,
Mm.
but the one that we call pimples is what is called acne vulgaris, and that's the commonest type of acne. About
Uh,
85% of people at some point in their life will have acne. So it's like the commonest skin condition in
mm,
the world. It's commoner in young people. So you find it more in teenagers or people when they're approaching adolescence and puberty. And that's one reason for that is because of the cause. And in most cases, as people approach adulthood, their 20s, 30s, it tends to reduce. However, some people do have the misfortune, I would say, of having acne well into their adult years, and they can actually have acne, that starts even as an adult. That's
hmm,
what we call adult onset acne. But for most people, it starts in puberty, in adolescence, and then it runs a course, and then it tends to stop or reduce gradually once they get into their 20s. However, that process, if not properly managed, can leave people with a lot of scars, both psychologically and physically on the face. And of course, it is a major cause of anxiety, low confidence, low self esteem, social ostracization, particularly in the age when you're just becoming aware of yourself, at adolescence, and then you'd have to battle with, blemishes and spots and bumps all over the face. So even though it's very rare for acne to cause loss of life or
mm.
anything like that, it has a major impact on people's quality of life and self-esteem. And I would take that back by saying that it doesn't cost people's lives, because people have actually been known to attempt self-harm,
Mm.
suicide, because of their battle with acne, because it affected their psychological well-being so severely. So treating acne is very important. In the past, people used to say, oh, it's part of growing up, it will go away with time. And in many cases, it wasn't treated or taken seriously. But now, because we realize that it has a very important um, negative effect on mental health, we realize that ignoring it is not the way to go. And also, if it's improperly treated, people can be left with long-term scars that are very difficult and also very expensive to treat. So it's always better to have it treated, even in the early ages.
Wow, that is quite holistic and covers a number of things. But I find it quite interesting that you said some people who escaped, that's how I heard it, some people who escaped acne in their adolescent years get
Yes.
to have it in their adulthood. Why?
Well, sometimes it's commoner in females, and it has to do with hormonal influences. So
Oh,
one of the causes, acne has four major things that cause it. There's the androgen or the hormones, that's like testosterone hormones, male hormones. Even though we're male and female, all of us have some degree of androgen or male hormones, even women.
mm,
And there's always a balance between the female hormones, female sex hormones, and the male sex hormones, the androgens and the estrogens.
yeah.
Sometimes people have what we call androgen sensitivity. They are more sensitive to androgen. So even a tiny increase in the androgen, even if it's in the normal range, can trigger the process that results in acne. Acne is also, the androgens cause um, the glands that produce oil to produce a bit more oil, and that's why you find males tend to have more oily skin when they have oily skin, and they
Mm,
tend to have more severe acne when they do have acne, and that has to do with the hormones. And so sometimes in when women reach a particular age, they tend to have a little bit of a drop in the female hormone, and then the male hormone become the balance, kind of changes, and that can result in them having acne in adulthood. So maybe when they were teenagers it didn't happen, but then they begin to now have, so there's something we call adult female acne. It's not so common, but we're seeing a bit more of it. Also, sometimes the kind of skincare products we use can trigger acne.
mm,
And if people are using things that contain a lot of things that affect your skin barrier, a bit too many of harsh products or oily products, what we call comedogenic products that contain a lot of oil, they can clog up the pores and you know lead to people having breakouts or acne. Also, sometimes people have what we call steroid induced acne, when
okay.
you're using too much of steroids, and we see a lot of that now, that people are mixing creams and doing all kinds of things. We see a lot of people coming with you know what is not the typical acne, but it looks like acne, and
Mm.
it just tells us that this person is using a steroid on their face, and over time they begin to have breakouts related to that. So that those are some of the types that we, can see in adulthood for both males and females.
Okay, I'll let you step down on that, and when we come back, we'll be talking more about acne. I'd like to ask why it is that some women, when it's time for their monthly flow, tend to have that breakouts.
Yes,
I do not understand it, but then we will get more clarity on it when we come back. This
right.
is Smooth 98.1.
Your music station.
Smooth. Love music. Love life.
And it just feels good. 98.1.
Smooth. 98.1.
Have a golden morning, a golden day, a golden week, a golden month, and a golden year. Golden Morn, delicious nourishment for the whole family.
What we're going to do right now is take you way back into time. Way back to timeless music. Let's get it on with Motown greatest hits from as far back as the 70s. Marvin Gaye, Soulful, The Temptations, Gloria Gaynor, Gladys Knight, Gladys Sexy. Enjoy the smooth collection and blend of Motown greatest hits on your radio. Motown
Okay,
Monday, every Monday from 11 a.m.
Smooth music.
yes, always. It will be defined by you, and we give it to you just like you like it. This is Smooth 98.1, the smoothest dial on Lagos Radio. And right now it's breakfast in bed, specifically the soul food conversation. We are talking about your face. acne or pimples, as it is colloquially called. And we're telling you some of the reasons that you have it. Yes, Dr. Folakemi Cole-Adeife is already breaking that down. And before that short breather, I did say I was curious about why women want minutes, they're fine, and like the British weather, they just have that pop out of the acne. Why?
Well, like I mentioned, it has to do with
Oh,
hormones. One of
yeah.
the major influences for acne or causes is your hormone levels. So when there's a little bit of fluctuation of the hormones, which occurs through the menstrual cycle, and towards the end of the menstrual cycle, the estrogen levels drop a little bit. So the androgens, the balance between the androgens and the estrogens kind of changes, and then androgens can trigger some people to have breakouts usually. So that can occur for quite a number of women. Some people say their acne is not related to their menstrual cycle, but for where there's a hormonal influence, that's when we see that. I wanted to talk about the other things involved in causing acne.
Yes, please.
And another thing is bacteria. So there's a bacteria called Cutibacterium acnes. And
Cutie.
yes,
Like cute.
like cute. I don't
Oh
know
no,
why.
that's not
So
cute.
so that bacteria is one funny bacteria because it's had like 4 or 5 different names over the course of history.
Okay.
When I was in medical school, it was called Propionibacterium acnes. Now it's called which is sure the same. It keeps trying to change its name, but we know
It's not cute at
it's
all.
not cute. So it does live on the skin in little amounts. So it's sometimes a normal commensal on particularly on the oily parts of the skin, the face, the back and the chest because it likes to eat oil. But sometimes it overgrows. So when there's a bit of excess oil and the right environment where the dead skin cells clog the pores of the face. So we have what we call the sebaceous gland, where hair and oil comes out, the pilosebaceous unit. So sometimes there's a tiny hole, and sometimes dead skin can get clogged into that space. And then when the dead skin gets clogged in there with the oil, the bacteria has a field day and starts to overgrow, overeat, and over multiply. And that's when the body now raises its alarm, like, oh, the police of the body come and say this bacteria is passing its boundary. The police in the body, that's the white cells, then come and try to kill the bacteria and throw bombs and tear gas and everything. And then that's when the breakouts happen. Is a combination of the body fighting the acne, which is becoming a hooligan or a hoodlum on the face, and the
Interesting
body
words.
fighting, so there's that, ongoing process. And that's where you have those big pimples, that contain pus. And, I actually have a pimple, a
Yeah, I
spot
can
on
see
my
that.
face, and that was because stress, which is another thing that can cause acne. So I've been doing a lot of work beginning of the year, writing some grand proposals and things, and it's been very stressful and not getting enough sleep. So yes, stress can trigger acne in some cases. So it does, occur from time to time because stress also affects your hormones, and it makes you secrete a hormone called cortisol.
Yeah, the
Cortisol,
stress hormone.
yeah, stress hormone. Cortisol can also be involved in, the causation of acne over time. So yes, so sometimes stress-induced acne can be a thing.
I guess it does make sense to call it beauty sleep when they tell you to get beauty
Oh,
sleep.
definitely. Sleep is really, really important for your skin and every other, organ in your body. It's when your skin can rest, recuperate. It's when, your body can calm down and get rid of all, the excess cortisol and excess, stress that you may have gone through during the day. So missing out on that can take its toll on your health and also on your skin.
Interesting. Now, since we are still on the causes of acne, let us debunk some myth if they are indeed myth or the effect.
Right.
Oily foods, do they cause acne?
Well, there's not enough evidence to, you know, scientifically that is true. There are a lot of studies that have been done on diet and acne, and most of them are not very strong evidence. Some people do, however, note that, they do have increased breakouts with that. It may be very subjective or maybe tailored to a particular person, but the science says not really. But there is some evidence that high sugar diets can worsen acne, not cause acne, but if you have a tendency to having acne and you eat a lot of sugary foods and refined foods, it can worsen the acne. And then some studies have shown a link between dairy, that's milk,
Mm.
and acne. Though those studies are very weak evidence, but I always tell people that every human being is unique. If you notice that when you eat oily things, your acne tends to get worse, then try to reduce it. So even if there's not enough general clinical evidence, it could, be a factor for a few people.
I do hope that we have more of these studies on black people because I
Yes,
realize a number of the studies
are
would,
not on black
yes.
people. Yes, so we are doing a lot of studies on our skin, on various skin conditions. In my department, we've done quite a few studies on things like diet. Even the one we did in our center, we didn't really find any association between diet and acne. For the one we investigated and interviewed about 200 women or thereabouts, and there wasn't any conclusive evidence that what they eat affected their acne or caused it or was involved in it.
Hmm, interesting. Now, a good number of people believe that acne is on the face or should be on the face, but we have seen people who have acne on their back, right? And
Yes.
their buttocks.
Well, on the buttocks may not be acne,
All right,
but
so
you have acne. Acne can be on the face, the chest, the back, the upper arms. So you tend to have it in areas where you have a lot of sebaceous or oil glands. Those are the areas that you have more oil on the skin. Like I said, because the Cutibacterium is an oil-loving bacteria, it tends to only stay on places where there's lots of oil. We have less oil on our arms and our legs. That's why, during the dry weather, they tend to get very dry and ashy. But the face tends to always, be oily, for people who have oily skin, and then the chest and the back as well. If you have some spots on the bum area, it's unlikely to be straightforward acne, although there are some people that have other types of issues that can lead to pimple like lesions on the buttocks. There is a condition we call hidradenitis suppurativa, or
okay,
called
break that down.
acne inversa. It's a very complicated thing. I don't want to, but it's like a more severe form of acne, so to speak, and can lead to boils in the
Mm.
underarms, in the armpits, in the groin area, and then people like that may have some acne like lesions on the bum area. But the regular acne, or that we know every day, usually is on the face, the chest, and the back. So you have people having back knee, as they call it, and on the chest, and then
Acne.
yeah, I've heard that term a couple of times, and it's quite common in males
Mm.
particularly, but we also see it in females as well.
Okay, as we gradually move to how you can deal with it. Now, it's been said, I don't know if it's by experts, but I know I have heard it many times that you shouldn't pick your pimple.
Yes.
Why?
Well, because picking it, number one, your fingers may be not be clean, and you may be introducing more bacteria into the mix, which is going to cause more wall. So you have the wall from the Cutibacterium acnes, then you may have another wall from some other organisms that you introduce into it when you press it with your fingers, which usually are laden with bacteria. So that's one. Number two is when you press or pick pimples, they tend to heal with scarring, and it's the scarring that you want to run away from. You have some people who have like deep pits and
Yeah.
scars in their face as a result of acne that they've had when they were younger or earlier, and those scars usually occur from pressing and picking. So I always tell people, do not allow anybody to burst or press. There are some people that
They enjoy it.
they see you and they say, come, let me help you to press. I'm like, please just run away from such people, because to treat those scars is very expensive. You need laser therapy, you need microneedling, you need a lot of dermatological procedures that cost quite a lot of money. So you're better off avoiding having those acne scarring, you know by not picking your pimples.
So, how should it go? I should just leave it and
Yes,
let it run
so
its course.
when you have a zit or a pimple, you apply the necessary things on it and let it run its course. Wash your face gently. The worst thing you can do when you have acne is to scrub your face with a sponge. you're just going to disseminate the problem, around and spread it to other parts of the face. So you don't want to do that at all. So you need to just wash gently. We always recommend you use a pH balance cleanser because that will help bring the skin back to an environment in which it can actually heal itself. So you want to cleanse with a pH balance cleanser, nothing too strong, no strong alcohol astringents, because that might ultimately make the face worse. And then you want to make sure that you use the right treatment. Basic treatment for acne is to use a topical antibiotic. You can get some over the counter in Nigeria here, like something like benzoyl peroxide. You can have low doses of benzoyl peroxide, and then a retinol. So retinol is, you could have something like adapalene. They are also sold over the counter in Nigeria. So if you have benzoyl peroxide and adapalene, um, and you apply that to the face, over time, you'll find that the acne will die down. There's some people though who would, of course, need to consult with a dermatologist because their acne is a bit more complicated. There are some other systemic problems that are associated with acne, especially when they are hormonally related. For instance, people who have PCOS, polycystic ovarian
Ovarian syndrome.
syndrome, one of the things that they can have because of the hormonal imbalance associated with that condition is acne. And their acne needs to be managed with medication, oral medications. Sometimes when acne is very severe, you do need to use a lot of oral medications, which can only be prescribed by a doctor. So you need to see a doctor when the acne is quite severe. If it's mild acne, you can get those products over the counter, use them, and most of the time they will work and clear out the acne.
Somebody is probably listening and saying, why would I want to go to a doctor just for pimples? Yes, you may need to go to a doctor for pimples, especially if it is something that has been persistent or has stayed with you over time and you have tried many things. And speaking of trying many things, there are some people who do a lot of DIYs. You have those combining some baking soda with
Yes.
lemon and a couple of things that I'm sure will be harsh to the
Yes,
skin.
people use all sorts, even lemon juice. Some people use toothpaste.
Yes,
I think when I was
toothpaste.
in secondary school, that was in common treatment for pimples. Well, those things are not tailored for acne, and they may actually cause more irritation on the skin than benefit. So you want to be careful what you put on your skin, and just don't just listen to anyone who says, "Oh, use this," because when you're walking on the streets with pimples, you find some people saying, "Oh, try this or use that," or they give you suggestions. It's not a good idea to just take suggestions from just anyone who doesn't have any training or experience on how to treat your acne. You should see a specialist, an expert. You can see a dermatologist, you can see a well-trained esthetician if it's not too serious. And some people say, "Oh, I'm going to go for facials for acne." That may not be the solution. The facials may just worsen the acne. So try to see a proper a dermatologist who is trained to treat the skin and to help you to manage the acne properly. The earlier you manage it properly, the less the chances of you developing long-term complications of acne, which I said are difficult and expensive to manage.
Okay, let me allow you digest what you just heard, and then I'll come back to give you the last stretch because we are almost out of time for this conversation. This is Smooth 98.1. We have about 4 minutes more.
Okay.
Love life.
Smooth 98.1.
It's going to be a golden year, this is what we declare. Every day you go wake up to golden morning if you agree, say yeah. It's going to be a golden year, as we don't declare. We go wake up every day to golden morning if you agree, say yeah. Have a golden day, a golden week, a golden month, and a golden year. Golden Morn, delicious nourishment for the whole family. bets they bring you mega prizes for this soccer tournament oh. Yes, now the Total Energies AFCON Bonanza. You don't hear am so sharp sharp go place bets for your favorite team for 1xbet and get that whooping win. Go place your bets for 1xbet.ng. Use promo code CAT Nigeria and win with 1xbet. 1xbet. Anybody fit dey lucky. Hello everyone, I'm Kabamza Sukor. What comes to mind when I think about music? I think about melodies, harmony, rhythm structure, lyrics. Music is life. Music is everything I do. Music is walking, talking, breathing, being happy, being sad. Feel the music. I live to make music.
Every time. Smooth 98.1. Love music, love life. This is the Soul Food Conversation. It's been an interesting one about acne, and you can be a part of the conversation now quickly by sending your WhatsApp message to 0809 Again, 0809 or you can call 01 But then take it that we have answered quite a number of your questions because I have answered what is in your mind. You can be very sure of that. Lastly, we do have people who say that once they see you with acne, chances are that your personal hygiene is next to zero. Is that true?
Oh, absolutely not. It doesn't have, anything to do with personal hygiene. Usually, if you have a family history of acne, yes, it can occur. And, if you just tend to have oily skin or any of the other associated factors, but it doesn't really have to do with hygiene. However, managing acne, you need to pay more attention to like washing your face. So when you come from work or from school, make sure that you wash your face of all the oil and dust and everything, and that does help. Yes, but the fact that a person has acne doesn't mean that they have poor hygiene. No.
What about makeup product?
Definitely you need to pay more attention to your makeup products. Things like brushes, your brushes need to be cleaned regularly. Try not to share makeup products, makeup puffs or pouches when you go for makeover or do makeup. Ask them to use fresh what do you call those puffs that they use to apply the foundation and all. They should try to use fresh ones and not use ones they've used for other people. So
Okay.
you have yours and you're not sharing, not only because of acne, but for other possible infections that other people could have, herpes and, other things that, people may have on their skin. So you want to make sure that you're not sharing any of those personal items. And then make sure that you wash off your makeup. It's one of the crimes, for women is to sleep with your makeup on. You should always wash it off so that your
Alright.
pores can be clear and they
Clear,
can
yeah.
breathe and you don't get them clogged and have them the cutibacterium begin to misbehave.
Hello, good morning. Hi, good morning. What's your name and
Morning.
location? Hey, Gary, it's been a minute. How are you? All right, so what do you have to say?
Good morning. How you doing? Great.
Mm,
Yes. Hmm. Yeah. Okay.
Okay.
I don't understand why is it so that because I know most people they don't share products and
Yes.
they tend to like clean their makeup thing very well. You know, do their makeup for sometimes it's always dirty, dirty type, but I know they clean it one by one.
Okay.
Yes. So I
Thank you,
think it,
Gary.
yes, it has
Thank
to
you.
do with the products. There are some products that are, like I mentioned earlier, oily or comedogenic. So they actually contain oil, and when people apply them on the face, they tend to clog the pores and cause, those bacteria that I spoke about to become very active and to overgrow. So if people, are advised to look for oil-free makeup, because once the makeup contains oil and they have a tendency to have acne, that kind of call, it's not, like I said, it's not related to hygiene.
Hygiene, yeah.
It's more related to the kind of makeup products that they're using.
All right, then. Thank you. Hello, good morning. Okay. Actually, we're out of time. I'll quickly take this one from Alex on WhatsApp saying, "Good morning, soup food crew." No, it is soul food.
It's soup, so food sounds more like soup, so I guess.
Does detoxification help in any way to clear acne apart from the external treatment? That is,
Well, some people do say, oh, detox, you drink this, drink that. The best detox, I would say, for the body, not just for the skin, is water. So
great.
drinking a lot of water is helpful. But don't drink too many mixtures and concoctions in the name of detox. Some of them can be harmful to your kidneys, to your liver. I would recommend drinking lots of water,
Okay.
and minding your business while you're at it.
Hello, good morning. I am not sure what is wrong, but yes, that's all that we can take. Thank you so much, Dr. Folakemi. It's always a pleasure to have you and give us all the information that we need. Quickly, what will be your final word?
So acne is something that almost everyone will face, at some point in time in their lives. It can be managed and not cured. Acne is not curable, but can be managed. And most people will outgrow it. It's important to find the correct management and not just do trial and error when managing acne. Try to see a dermatologist so that they can guide you on how to manage acne that you will result in the least amount of long-term complications and side effects.
Thank you
Thank
so
you.
much. Thank you. I look forward to another of these conversations with you. I'm
No
sure that will be
problem.
happening very, very soon.
Anytime. Thank
You
you.
can follow Dr. Folakemi on all social media platforms. Just search for Dr. Folakemi. But then on Instagram, Flaky Dancing Doctor. That's FLAKINDANCI.
ANCINDOC.
Thank you very
Flaky
much.
dancing.
And on Twitter, the same
The
thing.
same handle. Yeah.
Exactly. Flaky dancing doctor. She dances very well. And of course, she gives you the tips also. She has quite a number of educative videos on her YouTube channel, so you can catch up with that and follow everything. This is Smooth 98.1. Do not forget, 8:40 is the time for the kids between 6 to 15 years of age, and it's going to be a great time as always. I am looking forward to it. This is Breakfast in Bed here on Smooth 98.1. Thank you so, so much.
You're most welcome. It's always a pleasure.
Yeah, thank you.
Once
Okay.
upon a time,
All right, let me see you all.
All right. Thank
there
you.
was a
Gotta get back to this kids.
his name was Dinky He worked hard and pushed to be a chief just to be some king.
Oh yes.